Good afternoon. I'm Robin Strongin, and I direct the health policy work here at the National Consumers League. It's my pleasure to welcome everybody to today's vaccine roundtable. We have a lot of experts with us today to help us navigate this issue. And I'm going to just introduce everybody, and then we're going to dive right in. I do want to start by saying that National Consumers League was founded 125 years ago this year by some feisty, bold women reformers, one of whom, who was NCL, National Consumers League, first General Secretary by the name of Florence Kelley, actually advocated, in addition to labor and fair wages, for public health initiatives, almost all of which are in the newspaper today, everything from pasteurized milk to vaccines. And she actually had a personal story where she lost several siblings to diphtheria, and so has been a champion of vaccines at the turn of that century, over 100 years ago. And we're very proud to carry on that legacy, both of public health generally and specifically in this area of vaccine confidence. And one of the ways we do that is through a signature program of ours called Script Your Future, which you can go to at scriptyourfuture.org. And we've been doing a series of national campaigns to educate consumers on the importance of medication adherence. And we have come over the years to include vaccines within that rubric of adherence. And in order to do that, we're working with schools of pharmacy across the country, and we do what we lovingly refer to as a challenge. And different teams within the schools pull themselves together, work with professors, and they work very deeply within their local communities. We know that adherence, both to medication as well as to vaccine schedules, can be really tricky and complicated for many, many reasons. So we're pretty aware of many of the reasons why it's hard, but what we're trying to do is also share some of the lessons learned of what's working in the different communities. And we know there's no one answer. And in order to help us be able to learn more about what is working, and again, identify some of the unique challenges, perhaps from a cross-cutting look at different communities and different challenges, we've invited today's panelists here, who I will introduce momentarily. But before I do, I would like to do a shout out to Evan Wilson, who's a PharmD and a Master's of Public Health student at Johns Hopkins. His practicum was working with us on today's roundtable, and he did a lot of the background research, helped with a lot of the questions, and identifying a lot of our panelists here today. So a big thank you to Evan for his hard work on helping us today. And it is my pleasure. I will quickly introduce everybody, and then we're going to dive right in. Our first speaker is Lieutenant Shawnell Damon, and she is a senior public health advisor in the Indian Health Service. She was born and raised on the Navajo Nation and attended St. Michael Indian School. She led the COVID-19 response for the Navajo Nation, coordinating with all the federal, state, and tribal and urban organizations, and is currently, I believe, in your third year of your doctoral public health program at University of Arizona. And fortunately for us, her dissertation is on vaccine hesitancy. So that's very exciting and timely. So welcome. I also want to introduce Ashley Goss, who serves as Deputy Secretary of Public Health for the Kansas Department of Health and Environment. Deputy Secretary was appointed to this position in January 2017, and she oversees over 600 employees who serve Kansans through many of the public health roles, programs including local and rural health services, disease control and prevention, epidemiology, childcare, health promotion, oral health, lab services, just to name a few. And Ashley is joined by Lauren Swensson, who has served as the director of the Bureau of Disease Control and Prevention and is the state TB controller since August 2022. And she served as the deputy incident commander since July 2023 And in addition, Lauren is also serving in the Kansas Air National Guard as a medic and has a master's degree in public health and is pursuing her doctorate in health science. So wow. We are then followed by, to get to my notes, yes, Dr. Elena Rios, who is wearing two hats with us today and has been for a very long time, serving as president and CEO of the National Hispanic Medical Association, which represents 50,000 Hispanic physicians in the United States, as well as serving as the the head of the National Hispanic Health Foundation. And Dr. Rios has a very long and very distinguished career spanning federal, state, and local service, and is the recipient of many prestigious awards. Hannah Fish, PharmD, is the Director of Strategic Initiatives for the National Community Pharmacists Association. And among her many areas of responsibility, she currently leads NCPA's grant initiatives to improve pharmacy-based immunization. And we are also joined by Erin O'Malley, who is the Executive Director of the Coalition for Trust in Health and Science. And Erin leads the daily advancement of the organization's mission, vision, and values, and develops and executes strategies for continued growth of the organization. Erin and I and our organizations are collaborating on a number of mis- and disinformation projects. And one of the areas, as you might guess, has to do with vaccines. And so we're really delighted, Erin, that you could be here as well. And that rounds out our roundtable discussion today. And so without further ado, I'm going to ask Shawnell if you would like to jump in and share with us about the work that you and your team are doing through the Indian Health Service, what you're seeing and what you guys are doing to help move the needle.
So thank you very much for the introduction, and thank you for coming on and allowing me to speak today. I'm Shawnell Damon, and yes, we are doing a lot of great work at the Indian Health Service prior to COVID-19 and still today, post-COVID-19. Immunizations is a very important forefront in public health and prevention for us. So we do have this E3 initiative that really speaks to what we are trying to put forth at the Indian Health Service. That means every patient that we have encountered, every encounter that we get with the patient, and every recommended vaccine, we should try to make sure at those 3 encounters that we are vaccinating the appropriate vaccination for our people. And you can see that by our public health messaging, we have one message, and it's been very successful in our overall outreach to our population, especially during COVID-19. A lot of our messaging was put out to really communicate the importance of the vaccine in regards to our elders, our children, our family members who may be immune compromised, and really speaking to the whole family in regards to vaccines instead of just, okay, I'm up for a vaccine and this is why it's going to protect me. So we really went for a community approach when it comes to our vaccines. And also you'll see here in this public health message, we were really trying to reach out to our people. We had a shortage this year of RSV across the United States, and our CMO, Dr. Loretta Christensen, was able to leverage and secure more vaccines for our people who die at a higher rate, especially our babies, to RSV. So we were able to get this vaccine out to Alaska, to really places where it's hard to actually get in contact with these vaccines and put them out in our community. And you can see from our messaging that we're able to target the whole family, from our children to our elders. And that has been one of the big success stories for us. And then also partnering with our community, partnering with stakeholders, that's community health workers. Pharmacy has always been a great partnership with us within the Indian Health Service. We lean on to our pharmacists, we lean on our nurses, we lean on our public health workers, we lean on our community to really make sure that we're meeting the individual where they're at and getting them the vaccine, instead of having them having to come and drive to us. And every now and then, our clinics are far away from certain geographic locations. And so we make sure that we're having these vaccines available. We're making sure we're partnering with this, even the tribal 638, so that they can offset some of our, our capacity to provide these vaccines. So a lot of teamwork, a lot of strategy going into vaccines, and really making sure that we're a part of the community and partnering with the community. So those are some things that we've done very well when it comes to vaccines.
Fantastic. We're going to go around. I have a million questions, but I'm going to hold off so everybody has a chance to talk first, and then we'll dive in and get a little more granular. But let me throw it now to Kansas, the state of Kansas. Ashley and Lauren, take it away.
Hi, everybody.
Yeah, okay, great.
I'm Ashley Goss. I'm the Deputy Secretary for the Kansas Department of Health and Environment in Public Health. And I have with me Lauren Swensson, our Bureau Director of Bureau Disease Control and Prevention, where immunizations happen to live. So I will just talk for a couple of minutes and turn it over to Lauren, because she and her team are the ones who are still really involved in the grassroots work. One advantage I think that I bring to the table for our team and for Kansas is I came from a local health department in a very rural county. And so you get the perspective, I bring to the table the perspective of the thought process of maybe how those that live in our rural areas might think as far as vaccine and or recommendations from any form of government, state and federal. And so I think that's helpful when we're looking and trying to figure out how the messaging should play out for immunizations specifically. I'll let Lauren talk here in a second about our partnerships, but one very unique thing about Kansas is we're a very diverse state. So across our state, we have so many different cultures depending on where you're at, that we really have to take the time for not only our own teams to learn how best to communicate with the culture that we're working in, but also to be able to rely on our partnerships within the communities to educate us and create the partnerships so it's a two-way street, so that we are addressing the needs, answering the questions, ensuring that we aren't scaring someone or leading them down a path to where they might not understand. And so then it makes them even more hesitant than what they may have been. So I've been working in the world of vaccines now for about 18 years.
Oh my goodness.
So I've heard lots, and it's amazing to me where people hear different things or what they think might be true. And so that's one of the challenges that, though frustrating as a public health person, that I really enjoy, because it's great that we can go out and communicate, work with those, and try and get the most factual information at the forefront. And I'll let Lauren talk about some of our really great partnerships.
Ashley.
Wonderful.
So here within BDCP, the bureau that I direct, we house our immunization department. And we have our cooperative agreements with the CDC. And of course, that immunization money we've gotten for COVID as well. We also participate in the VFC program, Vaccine for Children program. We do not have an official vaccine for an adult program yet, but we are working on that, as well as house our 317 vaccine. We have state nurse vaccine consultants that are set up among 9 regions within our state. And that's really due to different population is kind of how we decided we'd go with those 9 regions and make sure that all of our nurses could best support those health departments. We've got about 100 health departments and 9 vaccine nurses to help support all of them. So we really do rely heavily on our local partners, and that being the local health departments as well as those grassroots partners. We were very fortunate during COVID-19 to receive that federal funding that we were able to use for some, let's see, what do I want to say? Our grant recipients, which we really hadn't been able to do before. More traditionally, it was that federal and then county level funding. We've reached over 80 grassroots partners that have been able to take advantage of some sort of vaccine funding, whether that be for COVID-19 or lifespan vaccines. or vaccines for children, which has been pretty phenomenal. Just like Ashley said, our landscape is very diverse, and I spoke with Robin a little bit about this earlier. We have these pockets. We've got 3 main metropolitan areas in Kansas, and the rest is sometimes what we like to call a health desert. In Southwest Kansas, there's about 3,000 people per primary care provider. So we do really rely on all of those partners, CHWs, local health departments, and things like that. So it's very unique, very diverse. Southwest Kansas, we've got about 47 different dialects that are spoken. So we do see a lot, meeting people where they're at, and making sure that those campaigns, it's not really a one size fits all, but being able to relate to everyone where they are and where they're coming from.
Wonderful, and no surprise, I have a lot of questions for you guys as well, but I'm gonna hold tight so everyone has a chance. Dr. Rios, you are next.
Okay. Well, thank
Welcome.
you. Thank you, Robin, for having me here. Like you said, I wear 2 hats, and let me talk about what both organizations have done with vaccinations, especially with the COVID pandemic. But we, under the National Hispanic Medical Association, which is a membership organization, we were pleasantly surprised, to have to close our offices in 2020, and we started a COVID-19 monthly seminar series using our doctors on the ground, whether they were intensive care doctors who found out you just couldn't use the big ventilators as everybody thought would be helpful. They actually provided horrible, deaths in our communities at the beginning of the pandemic. But we also had doctors who got involved with vaccinating their patients, going to homes, almost like a mobile clinic, but doctors actually doing their own thing. And also doctors having hospital parking lots where they actually had drive-in cars come in. And so we had seminars from doctors that were on the ground from Los Angeles to Miami. And and it was interesting to see their reaction to becoming more public health oriented and having to work with nursing homes and public health departments. So we had a really good exchange. We have a YouTube series for people that would like to hear what happened during 2020 all the way up until 2023. Then we got a CDC campaign, and also, just like was mentioned by the Indian Health Service, we decided not to focus on one person, but the family. And our campaign is called Vaccinate for All. And unlike the ad campaign, the ad council that had started their campaign about, having responsibility yourself for taking a shot, that kind of thing, we decided it really needed to be a family-focused campaign. So we did media training of the doctors and others and got them on Spanish TV, where there was a lot of misinformation. So I just have to say that we tried to counter that with trusted messengers. The other thing we did was, of course, the importance of working with our advocates. I'll just say those individuals that are change agents in all of our organizations, we brought them together as ambassadors. We call them champions, individuals and organizations that were listed on our new websites that we created for the campaign, and that still exists. We also created a bilingual website called hispanichealth.info, English and Spanish, for patients and providers, with lots of information really linked to CDC, especially for the vaccines. Now, the National Hispanic Health Foundation is not a membership organization, but we've had a scholarship for 20 years where we work hand in hand with other national Hispanic health professionals, the nurses, the dentists, we even created the National Hispanic Pharmacists Association, the PAs, and the Latino Caucus of the American Public Health Association, because we give scholarships to students that are in all of these different professions, not just medicine. So we decided that we would actually focus in on our leadership and having a leadership fellowship that we've had for many years, but focusing more on the importance of getting more recommendations on how to help our communities with that misinformation. We also were fortunate to get a Rockefeller grant to look at 3 cities, 3 out of the 5 cities that they focused on. We looked at Oakland, Houston, and Chicago, worked with the congressional offices to identify the community-based organization that Congress offices already work with. Again, those trusted organizations to get the word out to those communities through health fairs or whatever was happening in those communities. We actually gave many grants to those organizations and then got a lot of feedback on lessons learned to reach not only Hispanic, but African-American communities. We also met with the White House on the lessons learned from the Rockefeller grant. I was part of the steering committee of that grant, and it was really interesting to be able to talk about all of the different accomplishments that we've learned by actually having people on the ground in communities. So, and just to let you know, we're not really a direct-to-consumer organization. We've been educating providers all these years and networking with mentors from our elderly doctors with our young medical students and residents. And so this was a big change for us. We even got asked by a major construction company in the country to send out bilingual doctors to talk to their employees and families on Saturday afternoons. And so I have to say that we were able to get more visibility, both National Hispanic Medical Association and our National Hispanic Health Foundation. And we look forward to continuing the work, and the vaccine work that we've done also besides COVID-19 is really working on adult vaccines. We've been working on adult vaccines since H1N1 because again, our communities don't get the education because they don't have insurance, or there's language problems. There's also fear because of the undocumented. And I know we're going to talk a lot about that, but I just want to say that flu vaccine, seasonal flu vaccine, we have the worst records, our minority communities. So we needed to focus more on adults. So we were already engaged with, again, those doctors that are more public health focused, that want to be in media, that want to be leaders. And that's really what we've built. Our organizations are really built upon leaders in our communities that are very interested in mentoring the next generation. Since we've been around now for 30 years, so we've seen the generation change, and very excited about the future.
Fantastic. Thank you so much. Wonderful. Well, I'm glad that you're working closely with the pharmacists, because that's your cue, Hannah. The community pharmacy is really such an integral part of trying to help educate communities and deal with issues of hesitancy, access, confidence. So Hannah, you are up. It's all yours.
Awesome.
The floor is yours.
Thank you so much. I feel so privileged to be part of this roundtable. I can only echo the work of all of my colleagues on the panel today to just see the innovation that has happened in the past 5 years since we've had the COVID pandemic. But really, pharmacy is still kind of new to the vaccine scene. Really, pharmacy got the ability to vaccinate and administer vaccines somewhere in the mid to late 90s and has been progressively increasing throughout those years. But these are just some of those numbers that from the COVID pandemic, from the start of when we had vaccines to about the fall of 2022, and we've got some more data later, but you can see how many vaccines pharmacists were able to provide just during that time frame. And then what that actually resulted in as far as lives saved, hospitalizations prevented, and even cost savings to the healthcare system. So really, with pharmacy being involved, we add that level of accessibility and convenience, and working with all of our partners with public health, as well as our physicians and nurses, we often, as pharmacy and community pharmacy specifically, have some of those extra hours that we're open, or we're more open on weekends, where you can bring in your kids when you might not be able to go see that physician in the middle of the school day, for example. So really, we have kind of elevated that accessibility piece throughout our tenure of being able to vaccinate. And if you want to go to the next slide, you can see where pharmacy has authority across the country in some way, shape, or form to provide immunizations for the whole schedule of vaccines. There's some nuances with pharmacy in the way that we are able to actually administer vaccines, but every single state has the ability for pharmacists to immunize patients. And what's really exciting, not only to see this across the country, but if you see on the next slide, we've actually increased our availability and our accessibility by codifying our pharmacy technicians to be able to immunize as well. And so with that, that includes increased number of staff and increased availability for our pharmacy team members to immunize our patients. And so during the COVID pandemic, and now increasingly as we come out of COVID and we still have our respiratory virus seasons, but ultimately immunizations that are needed all year round, we are going into communities, we're delivering medications to patients' home. And some of those cases, we're able to bring vaccines to the home as well. During the COVID pandemic as well, we went into a lot of our long-term care and nursing homes. So some of our most vulnerable patients in the adult population were in these long-term care facilities, and pharmacy was really integral in partnering with those facilities to help make sure all of their residents were immunized as well. So, you know, in terms of the impact that pharmacy can make, really it's being that local community provider. And our colleagues from Kansas talked about the rural nature of some of our American communities and how there's potentially a health desert or a physician shortage where I think I heard that for one physician, there's 3,000 patients. Well, pharmacy is out there to be an extender to that. So if we're able to help vaccinate and immunize the communities where we need those support systems with the public health department, that's where we come into play. And a lot of our pharmacies also employ multilingual individuals. So if there is someone on staff that can speak Spanish or another language that can help bridge that gap and provide some of that education, we're really encouraged to know that pharmacy is taking that effort to provide some of those resources in those that they staff. So really exciting on the community pharmacy front, and love to be able to show and demonstrate that we are trying to expand that capability for pharmacy to play a role in vaccines and immunizations, and then get into those concerns about hesitancy and how we can also be a trusted resource to answer those questions.
And I'm very proud to say that Script Your Future, that's one of the specific areas that we're working with the schools of pharmacy and organizations like yours on the evolving role of the pharmacist, because our data do show that pharmacists are very highly trusted member of the healthcare team for sure. So
absolutely. And a lot of this, just to add, Robin, a lot of the students also have authority to give vaccines. So while they're doing their internships and rotations, we can leverage pharmacy students to provide immunizations as well, which is exciting.
Oh, absolutely. Absolutely. Okay, so Erin, we have heard the word misinformation come up, I think, in just about everybody's comments to us. And I know that's how you spend your days, trying to understand what's behind it, and more importantly, what to do about it and how to help consumers sort of navigate this toxic mess out there when it comes to dis, and not enough information. So your turn, Erin.
Wonderful. Thank you, Robin. And it's a pleasure to be with all of these distinguished ladies on the panel today. So a quick note about us. Pleased to be here on behalf of the Coalition for Trust in Health and Science. We recently celebrated our first anniversary as a nonprofit organization with the sole vision of helping people to make healthy decisions and to access quality evidence-based information so that they can make the right decisions for themselves, their families, and their communities. We are a big tent coalition, and we'll go to the next slide. I am pleased to say we have more than 90 member organizations. They are national in nature, spanning the entire health and science ecosystem. So that includes associations representing scientists who are working in labs today on the next generation of vaccines for the pipeline, to healthcare providers, to the facilities where care is provided, payers, foundations, of course, the patient and consumer voice, and even straight through to business entities who are thinking about healthcare. So next slide. So as you noted, Robin, we spend a lot of our time thinking about how do we dispel and combat mis and disinformation in the context of health and science, as well as to build trust. And so the work that we do on a daily basis it tends to be issue agnostic, if you will. We know there's misinformation in a number of different places, but in many respects, the elephant in the room is vaccine hesitancy, and it has continued to grow coming out of COVID. So as we dig into how do we empower our members, those 90 plus national organizations who touch tens of thousands of patients and consumers on a daily basis, we believe there are three really core foundations to reversing vaccine hesitancy. First and foremost, trust. And I think that really has been woven into so many of the remarks that we've already heard to date. It's important to note that trust develops over time. I know I've absolutely heard in our conversation today, meeting patients and consumers where they are, it is imperative. One manifestation of that is really seeking input from patients. I was having a conversation with an individual who was based in Florida during COVID and was tasked with vaccinating various patient populations. And one of the approaches that they used was not to sit down with patients and say, your child is scheduled to get this vaccine today, or you should be getting this vaccine today, but really start to neutralize the conversation by asking questions like, how does the vaccine fit into your life today? What are your top concerns? Do you know about this vaccine? Have you heard anything good or bad about it? Really neutralize and set the stage for a comfortable conversation as opposed to a direct, take this vaccine because I say to do it. Another core foundation, of course, is education. Pre-bunking is one of the technical terms that we're using a lot in the context of mis and disinformation, and it really is pre-education. I'm thinking a lot about pre-education, not just in the context of continuing education about vaccines that are currently on the market, where the science continues to evolve and the actual vaccine continues to evolve, but also thinking about it in terms of the deep pipeline of vaccines that are to come. If you think of where the nation and globe has been in vaccine development, we are always on the cusp of a new vaccine coming to market to help human health. And so what are we doing to pre-bunk, to get out ahead of any potential hesitancy that could be coming down the pike with new vaccines? Another critical element of education is, of course, communities. We've talked a great deal about how communities are of great value in helping to spread accurate information, but so are peer connections. If you are an individual who is surrounded by individuals who are vaccine hesitant, you're most likely to become vaccine hesitant as well. The final thing I will say under education is I was looking at some research data last night that really honed in on the fact that the second bullet under education, community and peers, those are trusted messengers and really something for us in the field to be paying a lot of attention to and empowering as it relates to vaccine hesitancy. My final point on the foundation is information access. Not only are we combating misinformation, but really thinking about the fact that so many people cannot access evidence-based health information very easily. You can easily put into a Google search your core question or area of research and get pulled down a rabbit hole of not helpful and oftentimes inaccurate information. We're actually thinking about the lack of access to evidence-based health information as a social determinant of health, the same way housing instability or food instability is. The final thing I will say that we often impart our members with is as they engage with patients, as they engage with consumers, this work takes time. It takes time to build trust, to educate, to ensure that the information we're giving is accurate, and it's a journey. So remember, please be patient as patients are on their, in particular, vaccine journey, but their health journey writ large.
Excellent. And I would also add with information access, not only is lacking access to evidence-based information an issue, but we still have a digital divide in this country, and the lack of just connectivity in rural areas, in underserved areas. So it's very hard. Lots of smartphones are out there, but certainly we still don't have it for everybody. So much to think about. I took a ton of notes, so I am going to just start with a couple of questions, and I'm going to circle back, if I may, Lieutenant, to you about if you could talk a little bit more about how you worked on the communications and how, because it is, you are working with so many different tribes and communities, and you've said that you boiled it down to one message, and we all know that words matter greatly. And one of the things I often wonder about is, the word vaccine itself is so politicized. I almost wonder if there's a different word. Somehow flu shot seems less political than something vaccine. And I just wonder, the use of words and communication tools, it does get at trust and all of that, but how did you work with all the different organizations and trusted sources to come down with one message? That is not easy to do. Can you share a little bit more about that?
Yes. The biggest step that we took as an agency and as an Indian Health Service was really getting the community at the table. And then also when we were doing these messaging, we definitely set up an ICS structure, of course, but we had one or a couple of direct chiefs involved with messaging. And so we were able to get a team together, and the team didn't just consist of Indian Health Service employees. It consisted of Tribal 638 employees. It consisted of elders and tribal health healers. Also, it consisted of youth. So once they were able to meet and actually establish a weekly meeting and saying, usually the first thing that we were trying to communicate before the vaccine was stay home. And that was one of our biggest messages during COVID at the beginning of the pandemic. So we had to translate those words into a lot of different dialects, languages, and really getting that message out to stay home. And then we started treating the family, the whole household. If one person was COVID positive, then the whole household was COVID positive. Because at that time too, we didn't have test kits.
Right.
Enough testing to go around. And then we were also inundated with our patients too. So we were really trying to work on our messaging. And so once we were able to get a diverse team together within the Navajo Nation, and then also you were able to utilize that model across the agency with other tribes, then they were able to get one message out. And so, and the message, definitely changed from staying home. Then also, it also changed to, okay, when we finally got the vaccine out there, was who's eligible first. And so it was really protecting our elders. And that was the biggest thing. And we had lines of people waiting to get vaccinated on the Navajo Nation and throughout Indian country. And so really making sure we were making that vaccine available and coming out into the community and getting the vaccine message out via radio. also because we have a lot of people who still listen to the radio. That's how they were able to get their information before. And then we had live public health Facebook messaging, of course, with our leaders and tribal leaders, and then also communicating via the newspaper. So we had to do a lot of like different types of outlets for our people across our reservations, but it really came down to assembling a diverse team of messaging members, and the team really worked on getting the information out timely, culturally appropriately. They utilized the language a lot, and we were able to really hone in on messages as the pandemic changed. And then also now after the pandemic, we're still utilizing those teams to communicate across the agency. And so we were able to utilize what we did at Navajo and at tribal, within tribal reservations. Also now across the Indian Health Service, we have a new public health strategic plan, which includes a One Health approach, where we include a lot of different diverse professionals within our team across the agency, not just doctors, not just nurses, not just pharmacists, but really including the tribal healer, really including the community, the promotora or the community health representative, and then really making sure that we have zoonotic. So right now, when we're transitioning to this H5N1, how are we going to really reach our population and just getting their flu shot? So that really protects us. Again, it imprints our immunity when we get our vaccines. And so those are some of the things that we're working on and continuing to utilize what worked during COVID-19 to post COVID-19 to really, again, hone in on the messaging and to pivot to more public health crises that might be, that may be coming to us, whether it be coming because of climate, just in regards to different viruses out there. So we're really trying to prepare and really work those teams now that we once established. We want to continue to have those established as we go forward.
Fantastic. Thank you. That's great. There's a lot there. Dr. Rios, I wanted to pick up on something you said, because when thinking about different communities and different challenges, you mentioned specifically undocumented and how challenging that issue can be when trying to reach, for public health reasons and so on. Can you speak a little bit to some of the initiatives and what you put in place? You and your teams?
Yeah, we have chapters in different places. So those chapters that, especially Texas, California, Arizona, New Mexico, that have doctors on the border, the US-Mexico border, we did activate them, especially with Spanish material and bilingual material for the younger adults and for the elders too, on the importance of getting vaccinated. And many of these areas they're very under-resourced and don't have hospitals or major medical practices, but there are clinics, and there are also like the Catholic Charities and other organizations that we ended up having doctors work with. So I think it's important to figure out in underserved areas, again, where there are some services to go to for the public health vaccination, I'll say programs that the public health departments put together. The other thing is that they're undocumented in major cities around the country, especially these sanctuary cities. And as we have seen in the news throughout the years of some of the states like Florida and Texas, where they're trying to, bus people away from the border areas to the north or to the west, to California, let's say, or to New York, and even Chicago. I mean, there were lots of undocumented that were actually displaced from the border areas, and so I think that doctors in those areas too were obviously interested in more education about our communities that were undocumented. So there has been, and there will continue to be more education from our organizations in our chapters in those local areas. And I think that's the beauty of having local
Sure.
chapters that can work with the Hispanic nurses and the Hispanic pharmacists and others, and with our students, because
Sure.
the students are in school in different places where they're undocumented. I think the last thing I'll say is that many of our families that are mixed status families, where the older people that, and I don't mean that old, but in the 1980s, there was a lot of Latin American uprising revolution. So a lot of families came over, and now the young people are in college or working, and their grandparents never, their parents never really learned English, and a lot of people are stuck at home. So it's important to realize how important it is to educate our families about the importance of vaccinations.
For sure. And when we did some work with the Coalition on Misinformation, often the young children are translating for their parents, and translating sensitive health information or very personal situations can get very dicey very quickly, and it's a big burden for children to have to be the translator in such areas. But I do want to follow up. Lauren, when we were chatting earlier this week, you spent some time explaining and kind of painting a picture for rural health in America. And it was, I'm from Brooklyn, so it was a whole new, I certainly read about what it's like, but you and Ashley are down there living this world. And I shared with you that at a previous breakfast on vaccine hesitancy months ago, somebody from not Kansas, but another state out west that's very rural was talking about how they immunize and vaccinate livestock more efficiently, better numbers than humans in the state, and that there's a huge acceptance among that, testing, and you shared that that's not unlike what happens in Kansas, but that there are a lot of reasons for that, and a lot of sort of solutions with, again, just like Shawnell is doing, partnering with local communities and grants. And if you could share a little bit about that, because it was really exciting to hear what you guys are putting in place down there that seems to be working really nicely.
Yes, thank you, Robin. Yes, so it really is. It's a very, very interesting landscape here, and I was born on the East Coast as well, so this was also eye-opening for me, coming from a little tiny state of Virginia to then have to drive across the state of Kansas. It's a little different.
Yeah, for sure.
It really is. But like I said earlier, we do have those metropolitan areas, but it's about 3 real large metropolitan areas, and those are on the eastern side of the state. You've got Kansas City, Johnson County, and then we have Wichita, kind of a little bit centrally located. And then once you get past there, it's wide open spaces. And I would jokingly say probably more cattle than people. Is what you see. It's beautiful, beautiful landscape, but it is very rural. And so when you are in those areas that just don't have that access to healthcare, or do not have, it's not very resource rich as you would see in a more urban area. People out there are doing, having to do so much with so much less, as far as doctors, practitioners, clinics, hospitals, all of those things are just very scarce the further west or south you go in our state. So we have.
I'm sorry. Is it the relationship with on the ground kind of grassroots organizations that you partner with that's helping with harder to reach, whether it's a physical, it's hard to reach just because they're so spread out, or it's one of the many dialects, and so you're really relying on that local, on the ground, trusted, again, source of, to what extent are folks going to the CDC website, let's say? versus not doing that?
Well, I probably say maybe not as much doing that. Obviously I do that a lot, but as far as going to those trusted resources, I think that's saying that a lot of people, that we've mentioned on this call, family members, of course, online. I would say, church members, we've had a lot of success with a lot of those church groups. But we really have become dependent, and COVID did, I'm sure, exacerbate that,
Sure.
just becoming so dependent, or having to build these relationships that maybe we hadn't had before.
That's a good point. Yeah.
And so much success. The grants that I mentioned earlier from that funding for the immunization section that we got, we were able to partner with over 100 different organizations over the last 4 years that maybe had not done anything with vaccine before, but certainly wanted to make sure that they were getting the right information out to their community members, starting with COVID-19 and then moving over to lifespan vaccines. So that's just been pretty phenomenal to be able to see that and the success we've had with that, starting with COVID, but then being able to expand more on that.
And it was interesting when we were talking to prepare for today that you pointed out, rightly so, that another measure of success is the lack of outbreaks. So and that's really important to keep in mind, because outbreaks can happen all over, but if you guys are able to maintain a lack of, that's a very positive metric to be proud of. So that was very impressive. I'm going to jump to you, Hannah, and ask you, one of the things we do with Script Your Future is really try to study and see how the evolving role of the pharmacist is coming to the fore. And I wonder if in the space of vaccines, what you guys are planning moving forward. Do you see more opportunity, more testing? What's happening at the pharmacy level these days that we should be aware of?
Yeah, absolutely. So I think, with the community perspective, I think for a lot of individuals, there's a lot of hype around all of our respiratory vaccine seasons. And now that we've introduced the RSV vaccine last year, then, we're looking at potentially 3 vaccines in your arm at once. And so I think the pharmacist is really trying to do their best job at educating on the timing of vaccines, but also focusing beyond that season into some of our more routine vaccines that we need, such as shingles or pneumococcal vaccines, as well as any potential travel vaccines, quite frankly, as people become more global in their travels and their adventures and are looking to explore the world. The opportunity to immunize for travel vaccines is also pretty outstanding. The other thing too is, with the COVID pandemic, pharmacy got more involved in what we call point of care testing. And so when the COVID test came out, we were able to offer those services. And then even in some limited cases, being able to prescribe antibiotics or antiviral medications. And so I think there's a really unique area for access and convenience within our partnerships with the rest of the healthcare team, but to help even patients discern when they're feeling sick and identifying what a person might have, and then being able to recommend a potential course of therapy or reiterate the point of getting a vaccine if it's not what they might have suspected. So being able to even differentiate between some of these respiratory virus come fall season again, is it that you have RSV, or is it that you have the flu shot, or if you have influenza? And if you don't have those, can we get you vaccinated as soon as possible?
Right.
So I really think the evolving role of the pharmacist and the team member overall is kind of both that seasonal nature when there's the big hype, but it is that routine recommendation as well, and being able to help provide information. And a lot of our pharmacists are getting really creative in their partnerships and how they're working to help individuals. There's one of our pharmacists that we like to highlight all the time that has actually transformed a part of their pharmacy into a neurodivergent sensory room. So they're able to immunize and vaccinate kids that might have autism or other types of neurodivergent disorders, where they're able to interact with the kids with, big colorful rooms or, kind of fidget toys to keep them distracted so that they're able to provide vaccines. So they're really getting creative in their ability to not only vaccinate our adult population, but where they're allowed to really help with some of our adolescent and kid populations, especially those that might have some unique challenges that aren't,
That's amazing. I love that. We'll have to share that with the
Yeah.
Scripter Future teams. That's great. And Erin, you're going to take it home for us here. And I'm particularly interested in how we can help younger people understand what's happening, because more and more we're trying to educate consumers about how to take control of your health. It is a world that is very different how young people access health information. I mean, in what world is TikTok the place to go for the health? But that's sort of where we're living right now. Influencers on TikTok seem to be the go-to. So I'm wondering what your data are showing and what words of wisdom you have for us to help with the younger generation, if you will.
Sure, thank you. So I think that's a really important question. You could almost point back to pre-bunking. How do we start by educating future generations about the benefits of vaccines? And I will talk about two initiatives. One is coming together now, and it would be a school-based initiative. The big caution there is that you have to work through local, county, city, state, in some respects, national curriculum to ensure that you can get these messages in. So that's a battle in and of itself. But the work would be focused on providing basic education, starting with history. I mean, think about, we're not even 2 to 3 generations away from the polio vaccine and what that meant in particular to Americans, the great achievement and victory and freedom that it provided. So setting that stage, setting that context. We talked about livestock. That is part of the curriculum as well, that vaccines are not just for humans and how it benefits all aspects of life writ large. Another element, travel. Young people eager to see the world, you'll need to vaccinate. And here's why. Here's what it looks like in other countries. So there's a lot of foundational education that we are setting the stage to be pushed out, ideally through schools. The one thing I will also caution is that as we develop these messages, it's also really important to notice that they actually are not just only intended for or consumable by children. And these, messages, especially thinking about a 5th grade, 6th grade reading level, those messages can be and will be replicated and repackaged for adults. For many adults, that is their reading level. And so, thinking about as we, build off infrastructures built during COVID, as we get the messaging right, ensuring that it's not only, geared to one population, but repurposed, recycled, scaled up or down for other initiatives. The final thing I will say is I am aware of a initiative right now that is attempting to influence the influencers or train the influencers. So for the handful of individuals on TikTok today who want to educate, not influence, how do we behind the scenes help them get the messages right, help them ensure that the information they're using and promoting is accurate. But again, that fine line between are they an educator or an influencer, regardless of the medium. And TikTok, of course, is one of the current ways to reach the youth of today, but we're always paying attention to what is that ideal medium.
Well, that's great. And we are almost at time. So I want to take a moment to just thank everybody. We will get this out and shared with all our schools of pharmacy, with all of you. We're going to show a last slide with everybody's information that'll be posted as well. And just a reminder that on scriptyourfuture.org, we have examples of our winning teams of what they've done in this area. And I want to close out by highlighting one of my favorites, which was Temple University. Their students worked with a local sorority in a very depressed neighborhood in Philadelphia and did a community baby shower for first-time moms. And they had standing room only. They sorority partnered with some other local community organizations. There were so many women, they ran out, they had these big fat diaper bags filled with onesies and diapers and all kinds of things. But equally important, the pharmacy students were the ones that shared information, nutrition and vaccine, what to know about when before, during, and after pregnancy for newborns and young children. And it was so successful. They kept doing it the next year, and it was hugely successful, easily scalable. And just it's all up there. The other examples of how students, because they're very relatable to many communities and many individuals who all day long hear people in authority tell them what else they need to do, they much prefer to speak to the students knowing there's a professor nearby. And when you feel that someone's relatable, you trust them more. And as we learned from Erin and everybody, trust really is the linchpin of communication and hearing what the other person is saying. So lots of lessons learned today. I'm deeply appreciative to all of you. And you can be sure you'll be hearing from me again. But thank you so much for taking the time and being on our round table today. Thank you again. Bye now.